Well, although there were 3 children in intensive care due to the Multisystem Inflammatory Syndrome in children, or MIS-C, locally, there have been no deaths. So says Medical Chief of Staff of the Eric Williams Medical Sciences Complex, Dr. Joanne Paul. So far, she says there have been 29 cases of MIS-C in Trinidad and Tobago, which is the highest number in the Caribbean, but believes there may soon be a spike in cases around the Caribbean. Sunalala has more.
Parents are being reminded to look out for 5 symptoms that their children may present with.
Fever for 5 days, looking at persistent diarrhea, looking at heart complications, brain complications, and also looking for that rash.
The Multisystem Inflammatory Syndrome in children, commonly known as MIS-C, is a condition where different body parts can become inflamed, something that develops in children approximately 4 to 6 weeks after they contract COVID-19. Dr. Paul says so far there have been 29 cases recorded in this country, some of which did not even test positive for the virus.
Out of that list, we have 3 who were COVID PCR positive. That means the swab was positive. But of course it makes sense because it's only done 4 to 6 weeks after the infective period. And then about approximately 18 of those had the antibody test being positive. And thus in terms of COVID test positive, we have about 21 children in that database who were COVID test positive.
MIS-C is said to last around 60 days in children around the world, but Dr. Paul says this is yet to be seen locally.
So we have seen some effects so far for the past 3 months, but internationally been seeing at least 6 months this can last for. So as we follow them up, we'll see if they're lasting longer than the 3 months so far.
And Dr. Paul believes there may soon be a spike of MIS-C cases in other Caribbean countries.
We had our spike August last year. Jamaica is now having their increased cases and Barbados had theirs, so they should look out for a spike in terms of the next 4 to 6 weeks.
Dr. Paul is reminding parents to be on the lookout for symptoms of MIS-C in their children that were diagnosed with COVID-19 and to seek medical attention since there is medication available to reduce the inflammatory response. Sonolala, TTT News.